Well, panic disorder is an anxiety disorder characterised by overwhelming anxiety that appears to occur out of the blue. So the uncued panic attacks is the way we would describe them. But panic attacks are characterised by a variety of physical symptoms that are really very frightening. So the person experiences palpitations, tremulousness, difficulty breathing, shortness of breath, a choking or smothering sensation, tremulousness, hot and cold flushes, they feel sweaty, etc. So these symptoms occur over a matter of minutes. So the individual experiences this overwhelming anxiety for a period of a few minutes and is then left thinking, what on earth was that? And of course, they then become preoccupied with the notion of having another panic attack. So they will start to avoid subtly things that might trigger a panic attack, like exercise or anything that might increase the heart rate or breathing rate, etc. Look, again, about 2 to 3% of the population in any 12-month period. Clearly it does, not so much as when it develops into agoraphobic avoidance, which we'll talk about shortly, but certainly in that the individual becomes incredibly frightened of these symptoms. They're catastrophically misinterpreted, so that the person thinks, I'm going to have a heart attack, collapse or die, etc. So of course they'll be reliant on family members to get them to accident and emergency or to the GP or whatever. And of course the distress in the family members will be, my goodness, what on earth is happening to our loved one? Well, as I said, one of the key features of panic disorder is the catastrophic misinterpretation of symptoms, that I'm going to have a heart attack, collapse or die. Cognitive behavioural treatment of panic disorder is all focused on teaching them that these are symptoms that are associated with an inappropriately released fight or flight response and aren't signals for danger, so that they then reinterpret these symptoms in a normal fashion and stop feeding the anxiety. What maintains panic disorder very much is the fear of the fear. Once we address that fear through exposure and cognitive interventions, then it settles.